Dr. Brett Haake, a Health Partners Medical Group physician and chief physician for the neuroscience programs at Health Partners and Regions Hospital. We wanted to sit down with Dr. Haake today to talk about stroke. We want to talk about the signs of a stroke, what you can do if someone is having a stroke. So Dr. Haake, thank you for your time today. I understand that stroke is the third leading cause of death in the United States. Is that correct?
Yeah, it's a very common cause of death after heart disease and cancer. It is something that affects many people's lives. In fact, 700,000 people in the United States each year suffer a stroke. 200,000 people die from a stroke. And about 4 million people in the United States have suffered a stroke at some point in their life.
Those statistics are very interesting, Dr. Haake. Can you tell me what the signs of a stroke are and how would someone recognize them?
A stroke is where a part of the brain suddenly stops functioning. So a person may lose their vision, they may lose their speech, they may lose the ability to use one side of their body or the other, they may become numb on one side or the other. One of the things we use, one of the acronyms we use for the American Stroke Association is FAST, F-A-S-T. F for weakness in the face, A for weakness in the arm, S for any changes in speech, and T for timing, trying to get patients to come to the hospital fast. And so if the face is weak, if it has a little bit of a droop, if a person has some slurring of their speech, or if you ask them to hold their hands out and one of their arms drift, typically that may be a sign of a stroke, and I would encourage people to come to the hospital right away if those things are recognized.
Thank you for sharing that acronym with us. I think that's something I can even remember. And when you say fast, Dr. Haake, what does that mean? Is there a certain time frame we should try to get people to the hospital in to help them?
The quicker we can get patients into the hospital, the better. In fact, when the brain is without blood flow, every minute that passes, 2 million nerve cells die, 14 billion connections are lost, and 7.5 million miles of coating around the nerves is lost. So when one recognizes stroke symptoms, they should immediately call 911 and just come straight to the hospital and let us sort it out. If we can treat a patient within 3 hours of stroke onset, we stand to help 32 out of 100 patients. If a patient gets to the hospital within 4.5 hours, we help about 16 out of 100 patients. If a patient just comes to the hospital, to a stroke hospital that gives good stroke care, about 10 out of 100 patients will benefit. And compare that to an aspirin a day or an aspirin at the time of stroke onset, which will help prevent or help 1 out of 100 patients.
Is there any way for someone to know if they've had a stroke? So if a person is alone and doesn't have someone around, can that person recognize that they're in danger?
Well, if a person recognizes that part of the brain isn't working, or that they are numb or weak, or have loss of vision or loss of speech, they also could try to reach out for help. One of the problems with stroke is that the person who is suffering the stroke may not be aware that they actually are having a problem. So it really requires an observer to be aware that the person is suffering symptoms, and then to not debate with the person whether it's a problem or not, because a lot of times the patient will say, hey, I just want to wait this out and see what happens. Really, it's best to just call 911 and get themselves to a stroke hospital.
What are some of the things that we can do to prevent a stroke?
There are things that individuals can do around leading healthy lifestyles and keeping their weight in check and not smoking. Risk factors for stroke include high blood pressure, diabetes, high cholesterol, tobacco use, excess alcohol use, obesity, and many of those things can be affected by patients. But they also should work with their doctor to make sure their blood pressure is under control and that they're on medications for cholesterol if that's necessary.
Well, thank you so much for your time today, Dr. Haake, and thank you for sharing that acronym with us. Is it FAST?
FAST. Yep, that's right. Thank you.